Hi, how are you doing? I'm finding you, sir. So, we did a few physical examinations as well as a blood test the last time you visited us, and unfortunately, you have Niemann's Pick disease. There's no cure for this disease, but do not worry because you have type C, which is able to be treated effectively. And if we start the medication today, you will be fine and symptoms will go away. So that's the good thing. So before I prescribe you your medication, I'd just like to tell you more of how this disease came about and what it actually does in the body and the treatment. So this disease is still rare to some people. As a matter of fact, 1 out of 40,000 people will get this disease. So it's not a common disease, and research is still being done on it, but it has been effective. Through clinical trials, we have seen medications and treatments that will be very effective in clearing the symptoms towards this disease. I remember the last visit you came, you said you had difficulty sleeping, you couldn't really think right, and you also said that you have difficulty walking. Well, this medication that I will prescribe you, named Miglustat, will get rid of all those complications for you. So that's the good thing. And another thing is, I don't want you to think that it is your fault. It is not your fault. 100% not your fault. As a matter of fact, you can't catch this disease from anyone else, and nothing can give you this disease. This disease actually was genetically inherited. So it came from your parents as well as other family members that might have this disease as well. So if you have any children or brothers and sisters, you might want to bring them in so they can also get tested and we can help them as soon as possible. So, with that being said, this disease has something to do with fats and cholesterol. And it's not only about that, but also the mutations. What's going on in your body is that some of the functions are starting to behave on its own, like it has a mind of its own. And to really explain to you what's going on, I also have a video that can show you and also explain to you what I'm going to say as well. So, for right now, I'll just summarize what the video will be about. So, basically, the disease affects the body's ability to metabolize fat, cholesterol, and lipids. And what happens is these cells malfunction over time and eventually they'll die. If left untreated, it can affect the brain, the nerves, the spleen, the liver, bone marrow, and also the lungs. So that's why it's important that we start treatment as soon as possible. Now, I applaud you for coming in as fast as you did because a lot of people are not concerned about their health and they don't take health seriously as you do. So let me just start by applauding you for you checking up on your body regularly. I'm very, very pleased with that. So before I show you this video, what you need to know about type C is that the brain can really, really be affected by this. As you said, when you talked about having problems with the thought process, it can be affected because the problem is your body is not really picking up information from your brain, and it's doing all types of things that may have your nervous system confused quite a bit. But that's okay because it will go away, I guarantee you. Let me show you a quick video as I'm reviewing your documents of how it is and what this disease is about. And as we're doing that, I'll review your physical examinations from the last time that we met. So this is more of what I said.
Niemann Pick disease type C, or NPC, is a rare, genetically inherited condition caused by mutations in either the NPC1 or NPC2 genes. These mutations impair intracellular transport of cholesterol and other molecules, which causes progressive neurologic and developmental problems. Now, cholesterol reaches the cells packed in lipoproteins, which bind to low-density lipoprotein, or LDL receptors, on the cell membrane to get inside the cell. Then, cholesterol reaches the early endosome, which is an intracellular organelle, that eventually matures into a late endosome, and finally into a lysosome. Inside the lysosome, cholesterol is processed and recycled, so that it can be incorporated into the cell membrane. To get out of the lysosome, first, cholesterol gets a little help from the NPC2 gene product, a protein that carries cholesterol up to the lysosomal membrane. And on this membrane, cholesterol is greeted by the NPC1 gene product, which is a glycoprotein that moves cholesterol out of the lysosome and into the cell. So with NPC1 or NPC2 mutations, intracellular cholesterol transport is impaired, so cholesterol accumulates inside lysosomes instead. Mutations can affect people of all ethnic backgrounds, and they're inherited in an autosomal recessive pattern, which means that an affected individual must have 2 copies of the mutated gene, one from each parent. Cholesterol buildup affects almost all cells, so it causes a variety of symptoms. The brain and bone marrow are often affected. The liver and spleen can be affected too, in which case they enlarge. Liver enlargement disrupts bile flow, causing bilirubin to accumulate in the blood. This leads to jaundice, or yellow pigmentation of the skin and whites of the eye. An enlarged spleen, on the other hand, may trap platelets, which causes easy bruising and bleeding issues. Finally, when this buildup occurs in macrophages, they develop a characteristic lipid-laden appearance under microscopy and are called foam cells. The most common symptoms are progressive neurologic symptoms, which occur in almost all affected individuals. With early infantile onset, there's usually low muscle tone and delay in developmental motor milestones, like lifting the head or crawling. Later, these children experience developmental regression. Infantile and childhood onset often begins with clumsiness and learning difficulties, and progresses to unsteady gait, difficulty swallowing, and slurred speech. Some children experience seizures or cataplexy, which is a sudden loss of muscle tone provoked by something perceived as amusing. With teenage or adult onset, there can be psychiatric symptoms and progressive cognitive impairment. Jaundice is more common in newborns, but rare in older children or adults. Late in the illness, patients lose the ability to walk, talk, and swallow, and respiratory failure is a frequent cause of death. Diagnosis of NPC is based on the clinical examination and history, and blood tests to detect biomarkers like bile acid metabolites and oxysterols. Finally, genetic analysis of the NPC1 and NPC2 genes confirms the diagnosis. Treatment involves supportive therapy, and in many countries, miglustat is used to slow neurological decline. Even though there is no cure for NPC yet, research is going strong, and several medications that target different steps in the pathology of NPC have shown promise in animal models of the disease and have progressed to clinical trials in humans.
So, basically, to summarize what this video was saying, NPC is a rare, progressive genetic disorder characterized by an inability of the body to transport cholesterol and other fatty substances like lipids inside of cells, which leads to the abnormal accumulation of these substances within various tissues of the body, including the brain tissue. That is why the brain is also affected. The accumulation of these substances will often damage the affected areas. So miglustat, as you've seen in the video, is what I will prescribe for you, and we will do a checkup every 2 months to make sure that everything is okay. Please feel free to call us if you discover any new symptoms, and we will go from there. And just continue to be very vigilant as you have been already, and observe any changes that you can in your body, and let us know as soon as possible. Please start the medication as soon as possible as well, and also tell any other family members that you have to come in and also get tested just like you did, so we can help them. We will be glad to do that as well. So here's your prescription. Thank you so much for showing up today. Have a nice day, sir.